Welcome back, future orthodontists. Today we cover distal movement of buccal segments, a key technique to gain space in the arch. Distal movement of buccal segments means moving the posterior teeth backward in the arch to create space for alignment of anterior teeth or correction of malocclusion. Remember the mnemonic BAC, backward arch correction. Common indications include crowding in the anterior segment, Class 2 molar correction, space creation for impacted canines or premolars, and correction of the dental midline. Use the mnemonic CCSC, crowding, Class 2, space, correction. Knowing the indication ensures the distalization is planned properly. Distal movement can be achieved with several methods. Headgear is an extraoral appliance applying force to upper molars. Pendulum appliance is a fixed intraoral device to distalize molars. Distal jet is another fixed appliance using springs for distal movement. Temporary anchorage devices, or TADs, provide absolute anchorage. Mnemonic HPDT, Headgear, Pendulum, Distal jet, TADs. Choice depends on patient compliance, age, and anchorage requirements. Important clinical considerations include monitoring anchorage to prevent unwanted anterior movement, controlling molar tipping and rotation, evaluating occlusion frequently, and adjusting force magnitude for patient age and bone density. Mnemonic ATOF, anchorage, tipping, occlusion, force. Attention to these ensures predictable and safe distalization. To summarize, distal movement of buccal segments essentials are definition BAC, backward arch correction, indications CCSC, crowding, Class 2, space, correction, methods HPDT, headgear, pendulum, distal jet, TADs, clinical considerations ATOF, anchorage, tipping, occlusion, force. Quiz time. Question 1. What does BAC stand for? Question 2. Which is not an indication for distal movement? Question 3. Which appliances can be used for distalization? Question 4. Key clinical considerations include what? Excellent. You now understand how to plan and execute distal movement of buccal segments. Next video, buccally displaced maxillary canines.